Hello, this is Allison Newhart. I am presenting on behalf of Indiana State University, Community Health Nursing, Spring 2021. And I'll be going over type 2 diabetes, also known as diabetes mellitus, or adult onset diabetes. So what are we going to learn from this presentation? I'm hopeful that you'll be able to name the major characteristics of type 2 diabetes, list the signs and symptoms, identify risk factors, describe the current treatments, identify consequences of non-adherence to treatment, and recall diagnostic and supportive resources. Take a chance to pause the video and take the pretest. Once you are done, go ahead and push play and we will continue. What is diabetes? Diabetes is an issue with the processing of glucose. It can be genetic, it can be related to your weight, it can be related to a lot of things, a sedentary lifestyle. But basically, it's the inability to process the sugar as fast as it's being ingested. So if you eat a lot of sugar, a lot of carbohydrates, then your body has to create something in order to use it. Now that is insulin, which is produced by the pancreas. So it's like it's a gatekeeper. The pancreas and the insulin is. So the tissues don't have access to the glucose unless there's insulin. It kind of brings it across the membrane. So you can end up with a lot of sugar in your blood, which is not good. Over time, the pancreas gets overdone, can't keep up with the demand. It kind of creates insulin not at a very steady pace. So you work something too hard and typically it will give out. So it's really important that your pancreas works, that we're not eating too much sugar, that our pancreas can keep up with the changes in our blood sugar. Hopefully it's not too drastic because that's when you have the problem. You go from either all the way or constant sugar in the bloodstream, or there's spikes. The pancreas is trying to figure out what's going on. So the best thing is to just have a steady flow of glucose that you ingest. Here's some diagrams. I think they're pretty awesome. So diabetes is the 7th largest leading cause of death. It was, according to the American Diabetes Association, in 2017. So that's pretty large, even though I guess a lot of times the death certificates do not always reflect that, which is very concerning, but it's a major issue. Signs and symptoms of diabetes might be increased thirst, fatigue, vision changes, increased urination, increased hunger, weight loss. The weight loss is usually muscle wasting because the muscle doesn't have access to the glucose, which it needs to survive. So that's not good. Prolonged healing. If you get a sore or if you hurt yourself, it'll take a lot longer for your wounds to be healing. Multiple infections, especially yeast infections, discoloration of skin, tingling of fingers or toes, that's known as peripheral neuropathy, and altered mood. The at-risk population, individuals who are pregnant can get gestational diabetes, and they are actually more susceptible to developing full-on type 2 diabetes later on in life. Can be genetically inherited from your parents or your grandparents or what have you. Can be diet. You eat a lot of carbohydrates and sugars. As you age, you have a increased chance of developing type 2 diabetes. Sedentary lifestyle, weight, the fat distribution. Those with a larger midsection typically will develop diabetes. Prediabetes, of course, polycystic ovary disease, and also some races and ethnicities, such as the Native Americans, Alaskan Natives, African Americans, Hispanics. These are some of the large races, ethnicities that are susceptible to developing diabetes. Another area that is of major concern regarding diabetes is the increased flux of children developing type 2 diabetes. Now, a lot of children might be diagnosed with type 1 diabetes, which is genetic. They don't make any insulin at all. It's not diet related. It's not related to anything else. And we usually said that we often referred to it as youth diabetes, or so for children to be getting diagnosed with type 2 diabetes is very concerning. The reasons why is most potentially from the decreased activity. We aren't outside as much, with the digital age. We're inside more. The food that we eat is processed and high in sugar. Ketchup has sugar. So there's about between 2014 and 2015, there was roughly 5,800 youth that were diagnosed with type 2 diabetes, according to the American Diabetes Association. And 25% of the population under 20, 0.25% of the population under 20 was diagnosed with diabetes. The treatments, we have holistic approaches, which include modifying diet, increasing exercise, decreasing weight and BMI, quit smoking, and decreasing alcohol intake. This can have a substantial effect on type 2 diabetes if it's newly diagnosed. If it's typically the sooner that you start changing your habits, you have an increased chance of reversing the diagnosis. The longer that you wait, the more non-adherent you are, the less likely you will be able to change your diagnosis. We have oral anti-hyperglycemics, like metformin. We usually try that first. If that is not effective in moderating the glucose, the blood glucose, then we'll do insulin. In the recent years, we've seen implanted automated devices where, as you see on the screen, they deliver insulin automatically, or they do the blood sugar checks automatically without being painful. It's on your arm or somewhere, and instead of pricking your finger all the time, it's really helpful in keeping patients adherent to testing their blood glucose. The testing of the fingers was, a major downside, and a lot of people don't test their blood sugar because of that. Tips on how to change your diet so that you can be more adherent and kind of moderate your blood sugar levels. You can go to myplate.gov. They say, on the diagram, they can show you how much you should be eating of each diet group, food group, and exercise is really, really helpful. The muscles need glucose, and they grab the glucose from the bloodstream. So if you do some exercising, at least 30 minutes after you eat is really when you should be exercising. Exercising at all would be great, but within that time frame is great, because within 90 minutes of eating, that's when you have the highest glucose levels. So you kind of get to shave off a little bit of that glucose by using it by exercising. You can also go down to the cdc.gov, diabetes, managing, eat well, link at the bottom. The consequences if you don't take care of your diabetes: decreased vision, heart disease, stroke, nerve damage, limb amputation, and kidney failure. Kidney failure is not good because you can be on dialysis, where that takes 3 days a week for you to get your blood filtered, since you no longer have the use of your kidneys. Here's some supportive organizations: American Diabetes Association. There's Mayo Clinic for information. CVS has a no cost, no catch screening program. And here's the pictures that I got from the website. Looks like literally no cost, no catch. Just got to find a location near you. You can get free diabetes screenings at CVS, Walgreens, Walmart, Sam's Club, Costco, and others. If you want to know your risk, you can go to the link at the bottom, www.diabetes.org/risk test. And please feel free to take the post test.